This quad we're doing an MO, a little vestibular. This is going to be a crown on this molar. You can see the shadow of the decay here. You can see the decay here, and then radiographically, and then there's a distal on that cuspid that we're gonna do too. A little bit of plaque. We're gonna get that all at the end. We'll give him a little prophy at the very end. So I'm gonna cut my MO first, and so there's a little pit here on that distal that I'm gonna get as well. So we're going to get that, but we're not going to join them all up. No need for that. But I do want enough space into the occlusal of that tooth to get some good retention and, you know, those good old-fashioned dovetails. So we want to get down, down, down into that gingival box and as far down as we can go. So right down to a nice solid floor of that gingiva. I'm going to get all the way down to make sure that we have enough width too, right? We don't want to invade the pulp, but we need to have enough width in that box so that we have the strength of the material. Otherwise, if you don't have enough depth and enough width, what we're going to have is we're going to have a cracked composite restoration. Okay, and I still see some decalcification at the very bottom of that. So we're just going to go in for just a little bit more, but we're very close to being where we need to be. We're going to do our little buckle here, and then we'll give it a good rinse and a dry and see exactly where we are if we're ready to put in our composite restoration. So I'm going to take a look with my mirror. No, I still got some decal down at the bottom, so I'm going to go even a little bit further and see if we can all see where we're going at the same time here. I think we're exactly where we need to be here. So we're gonna get another little rinse and a dry. Okay, so we're pretty good. Now I see I'm gonna have a little bit of a problem getting my matrix in right over here on the distal of my prep. So I'm gonna go in and I'm gonna cut my molar that I'm gonna crown. I'm gonna cut it just a little bit down. Because I don't want to bend my matrix band, and these matrix bands are very soft, so if I have the least bit of resistance, then I'm going to have a problem. So we're going down, so just like a little seesaw back and forth to work past it if you're having trouble getting it down. And if you're really caught up on something, then you're going to bend your matrix band, and a lot of times you're just way better off starting off again with a new matrix band if you've bent it rather than trying to smooth it out. Okay, so my little wedge goes in. Make sure that your matrix band is tucked up as best against the tooth as you can, because you don't want to catch it underneath your ring. So we're going to put our ring on next, and our ring is going to go on. Our blue ones are nice to use. They fit real nicely. Make sure that that matrix band is not caught underneath, and we've got our whole little system in place there. So at this point you need to check and see that you're down to the box, see where you need to go. And we're going to give it a little rinse and a dry, and I'm nice and tight at that gingival margin, which is exactly where I need to be, because I don't want to have any leakage, and that's the main reason that I'm using the matrix band in this type of a situation, is so that I don't have any leakage from that gingival margin. Remember, I had a little buckle here, so I'm going to get some etch on there, and a nice little selective etch, or at least that's my goal, is to do a selective etch here. And remember, there was a little distal spot. That's like a lot of etch, not a little etch, but that's okay, because we got our universal bond that we're using. And that universal bond is going to work in any way that I want it to, whether it's a self-etch or a selective etch or a total etch. So that's where we're at. Give it a good wash and a dry. And then we're going to put in our adhesive. So we got our little buckle there, got our little distal spot there, and then we're going to get adhesive all the way along the enamel and into the dentin. I'm just going to take a little peek with my mirror, because that angle is not the most terrific. There we go, that's better. I'm going to do a little bit of air and blow off the solvent, and then we're going to do some light cure on there. Okay, so we're going to do our snowplow technique. So this is the Estelite Flowable. Now we're getting right down to the base, just a very thin layer of flowable at the base, and that's working as like caulking, and that's going to fill in any kind of cracks or voids that we have. So that's the base of it, and I'm not curing it. And now I'm putting in, this is Omnichroma, a Tokuyama product again, and that's going down to the base of that restoration. And that warmer, that's a Voco caps warmer. That's the one I'm using there. So it was one of those products that I never knew I couldn't live without until I had it, and it's really, I love working with it, and especially with the stiffer composites. So something like a Grandioso from Voco, that's a very highly filled material, is quite stiff to work with, and this caps warmer just makes it so beautiful to get it in place. These instruments that I'm using are LM instruments. They're called Dark Diamond. LM is the manufacturer. In Canada, they're sold through Bisco. I'm not sure if that's the same in the States, but they're also really, really nice instruments to work with. So we're just getting that composite down where it needs to be. Don't worry about flash. We're just picking it off. If you can pick off the flash before you cure it, makes your life a whole lot easier. Just want to take a peek over here on the buckle. I can't quite visualize where we're at here, just because we've got a little bit of a void going on there, and so we've got also a little bit of polishing that needs to happen. And now we're going to cure it, and then we're going to do our capping layer with our flowable over top. So these make for a nice long-lasting combination of materials and equipment, because if you want to do good dentistry, you got to have good stuff to work with. Otherwise you wind up redoing stuff, and none of us like to redo things, because it's super fun the first time, but the second time maybe not so much fun. A little bit of flowable, just like a sealant, and I see a little fleck of something dark at the very back of this tooth. Do you have an Explorer? Maybe I can get that off. If not, I'll polish it off. I'm not sure. Just a little bit of a groove. We'll get that polished out. We'll get that polished out in the end. Okay, so we're going to do our final cure, take a little look at it, and then we're going to take our Garrison matrix system off and go on to our crown and to our distal or our cuspid. Alrighty, so we're going to access the distal of the cuspid through our first primary molar. You can see all that decay on that first primary molar, lots of decay on that mesial. And I can see my distal here is fairly bigger than I want it to be, that's for sure. But if I can just get in through here, keep it nice and conservative, and I don't have to, otherwise if I was cutting into this cuspid any other way, I'd have to cut in through the buccal or through the lingual and be making a much bigger access area. So if we can avoid that, then we save the tooth structure, and in this case, that saved tooth structure is going to make for a longer lasting restoration. So I'm just in with a slow speed. This has a fair bit of decay. I'm not sure if you can see where it is or where it's coming out, but we'll get in there a little bit more still. Okay, now we're going to wash and dry. And let's put in a second one of our wedges. I love them because they don't back out and they're soft. So they're good for lots of things. I still use a wooden wedge at times, fairly regularly. But this is our new generation of wedges right now. I think we're getting skid marks is what we're seeing where that black is. Okay, one more, and still more decay. This is, the sugar bugs had a little tooth party on here, as I'll say in the office. Okay, we're good, we're clean. So a little bit of etch in there, not a lot of etch, a little bit of etch. And so this kind of area, I'm not able to be precise enough to get that selective etch that I usually like. So we'll do a total etch and that's fine. Wash dry. Okay. And we're gonna go in there. And a little bit of air and light. Same kind of thing with our base that we're gonna use is the Flowable, the Estolite. And we're gonna go right down. Not a super easy area to access, probably really difficult for you to see too. Okay. And then we got to put a little bit of composite in there. And then I'm going to take a flat from you and we're going to get that in, packed in. Okay, take away our excess. Easier to clean now while it's soft than after it's cured. That's always the case. And don't worry about bonding to the tooth beside. We're cutting a crown there, so we're gonna just cut through there. Okay, and we can cure. Okay, lovely. Take our little wedges out. Oh, bring them back and take them out. Okay. Alright, and now we're going to do we've got our occlusal done, remember, for our crown. I'm going to go and do our distal slice. If I need any touching up on my second primary molar, I'll do that now. But it's looking pretty good there. Little corner. And I'm really not taking away, so I had the matrix band on there. I'm really not taking away any of that contact area because our goal really is to keep that mesiodistal width of that molar that I'm crowning the same as when I started. So if I get a good fitting crown, I'm not really losing anything. And as I'm cutting my mesial here of the first primary molar, I'm contouring my custard. Okay, that's nice, but we want a little tighter, so we're going to crimp it. Good, good. And there we are. Nice little snap down. Let's fill it with glue. There we go. That cement is super slippery, which is great for getting the crown down, but not so great when you get it all over your fingers. Okay, we'll floss between, clean up some of that cement. 1 and 2, give it another little push. We should give it another wash before we take the dam off, just so that we can have a nice final looking picture. Okay, looking good. Okay, and down to the last quadrant.